Hello, this is Dr. David Green, Education Director at Premier Pain Specialists in Chicago. Today's topic is what you need to know about facet injections. What is a facet joint? It's spelled F-A-C-E-T. These are small thumbnail-sized joints on either side of the spine at every level, all the way from the neck down to the sacrum. So you have one on the left, right, left, right. These joints have cartilage, just like the hip or the knee, and they combine to allow for an incredible range of motion of the spine. Facet joints are prone to arthritis just like other cartilage-bearing joints. Even though they are small, they can cause a tremendous amount of pain. Typically, it leads to pain in the vicinity of the arthritic joint. Often patients have several arthritic joints at the same time. If you have one arthritic facet joint, a lot of times you have several. Here you see an example. This is the back of the spine, okay? And these are the facet joints. This one looks fine, actually. This one looks all inflamed, extra bone formation, okay? Same thing here, and then this one looks fine. It's actually affecting the nerve roots as they try to get out. They're getting inflamed as well. Why are facet joint injections performed? For symptomatic facet arthritis, there really isn't a great surgical answer. We don't have a facet joint replacement. There are several excellent non-operative options, and facet joint injections are one of them. Similar to other joints with arthritis, facet joints respond well to steroid injections. Okay, see the needle going right into the joint. Facet injection, it takes about 20 minutes. It's outpatient. Modern pain doctors do use image guidance with fluoroscopy, so they can see a real-time x-ray. Usually the IV sedation is not required for these injections. The skin is numbed up along with the soft tissues down to the joint. The needle's placed into the joint, okay, along with some dye to make sure that the injection's accurate. And then once that's assured, steroid and numbing medicine is applied, okay? Several levels can be treated simultaneously, and the procedure can be repeated every few months. How well do they work? 82% of patients receive pain relief of over 50%. And significant functional improvement was also seen in almost 80%. And that's with or without steroid. So just the numbing medicine has a significant effect. The average duration of pain relief from facet injections was 15 weeks. And the same results was also seen in a large 2007 study. The procedure is an excellent non-operative method of achieving neck or back pain relief due to spinal arthritis. Well, what happens if the pain comes back? There are three treatment options. One is to repeat the facet injection, okay? Second is to perform a medial branch block. That's when the needle doesn't go right into the joint. It goes around the joint to help deaden these little nerve endings that supply sensation. Those are called the medial branches, all right? The next option is to move on to a radiofrequency ablation, which is actually where a catheter is put in around the joint and heated up with thermal and deadens these medial branches. That can provide pain relief anywhere from 6 months up to 18 months. Unreal. Are there risks? They're very low risk with facet joint injections. There's a slight risk of infection, bleeding, allergic reaction. The needle does not go into the epidural space, so there's a negligible risk of a nerve root injury. The top non-operative pain management in Chicago is with Premier Pain Specialists. There are several clinics throughout the metro area, accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning pain doctors. Visit us online at ppschicago.com and then call us for more information and scheduling at 847-519-4701. Thank you very much for watching.